Okay, so I'm also now going to check the lymph nodes in your upper extremities on each side. So hold up your right arm for me. First, I'm going to check your central lymph node, and then I'm going to check your lateral lymph node, and then your pectoral lymph node, and then your subscapular, and lastly, your infraclavicular. Any pain or tenderness?
No.
Excellent. You can relax that arm. Same thing on the other side. Lift up your arm. I'm going to check your central, your lateral, the pectoral, and then the subscapular, and lastly, the infraclavicular. Any pain or tenderness?
No.
Excellent. So you can relax. So no pain or tenderness in the upper extremity lymph nodes. Very good. Now I'm going to have you turn around for me and face the other direction. So I'm going to inspect and palpate the posterior thorax. I'm going to pull your shirt up too. Sure. So the patient's AP diameter on inspection is normal at a 1 to 2. I'm going to inspect and palpate your skin next. So your skin is intact, nice and warm throughout, and hair is evenly distributed. There's no lesions or bruising noted or any abnormalities. Now I'm going to palpate for thoracic expansion of your chest. Sorry, my hands are cold. Nice deep breath in and out. Excellent. So equal expansion of the patient's chest when he takes a deep breath in and out. Very good. Next, I'm going to palpate your spinous process and your vertebral muscles as well. So upon palpation, the spine is midline, and the spinous and paravertebral muscles are intact as well. Good. Now I'm going to do a percussion on the posterior side, about 10 areas. So here we go. Okay, very good. So all of the patient's lung sounds are resonant, even in the bases bilaterally. Now I'm going to go ahead and auscultate with my stethoscope. Okay, go ahead and breathe deeply through your mouth when I tell you to do so. So I'm going to auscultate 10 areas on the posterior side. Deep breath in and out. Comparing side to side, same thing. Again. Cool. And last but not least, deep breath in and out. Excellent. So the patient does have clear lung sounds bilaterally in the upper, middle, and lower airways. Next, I'm going to check patient's CVA tenderness to see if he has any. So cold hands again, little bump on the right side. Any pain or tenderness?
No.
Good. Same thing on your left. Pain or tenderness?
No.
So patient does not have any CVA pain or tenderness noted. So at this point, if I had a female patient, I'll cover you up for now. I would do a breast inspection of the patient, a breast exam. So I would check the patient's breast size and symmetry. I would use 3 different positions to see if we can bring out any dimples in the breast. The first one is the arms at the side. Next would be the hands on the hips. And then the arms raised, and sometimes that can just kind of help bring out any dimples if there are any in the breast. Next, I would palpate the breast evenly throughout, all the way around the nipple, using 3 fingers. I would also position the client laying down with a pillow behind the scapula and the arm raised, and check all quadrants of both breasts to check for any abnormalities, masses, or dimples. I would also check the nipple and the tail of Spence as well. I would teach the patient to do at-home breast exams once a month in front of mirror and in the shower, using those same body positions, and 3 fingers to palpate around each breast to check for any dimples. Typically, it's done once a month, 7 days after the patient has had their period. And then it could be in the shower and laying down as well. Okay. I'm going to have you go ahead and lay on your back for me now, China, and I'll cover you with a blanket to maintain privacy. Okay. Okay, so I'm going to pull up your shirt, keep you covered, and I'm assessing the patient's anterior chest. His skin is nice and warm, hair is distributed evenly, there's no lesions, bruising, and I'm also noting symmetry of his chest, which is equal, no indentations, there's no bulges or retractions either. And I've noticed that his rise and fall of the chest while he's breathing is symmetrical and even. His rhythm of breathing is relaxed, calm, with no distress, and it's regular, inhalation and exhalation. Now I'm going to auscultate. I'll put your shirt down to auscultate the 8 areas of the anterior chest. Okay, deep breath in and out. Again. 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 And last. Excellent. So the patient has clear lung sounds in all fields upon anterior auscultation with my stethoscope. Now I'm going to inspect your precordium. So I'm feeling around here. And so I do not feel any pulsation, lifts, or thrills. Good. Now I'm going to feel for your PMI, which is the regular rate and rhythm, about a 2+ amplitude, and it's found at the 5th intercostal space at the midclavicular line. Excellent. Okay, and then next I'm going to be auscultating your pericardium. So first is the aortic, which is the 2nd right intercostal space at the right sternal border. Next will be your pulmonic at the 2nd left intercostal space at the sternal border. Next is herbs at the 3rd left intercostal space at the sternal border. Next would be your tricuspid, which is the 4th left intercostal space at the sternal border. And then your mitral, which is the 5th intercostal space at the mid-clavicular line. Good. So I'm also going to auscultate your apical pulse for a full minute. Okay, and your rate was about 72 beats per minute with a regular rate and rhythm as well.
Thank you.
Now I'm going to listen to the same areas of your pericardium using the bell of my stethoscope to listen for bruits or murmurs. Okay, so first is the aortic at the second right intercostal space at the sternal border. Next is pulmonic at the second left intercostal space at the sternal border. Next is herbs at the third left intercostal space at the sternal border. Next is tricuspid at the fourth left intercostal space at the sternal border. And then mitral, which is the fifth left intercostal space at the mid-clavicular line. Very good. And I did not hear any bruits or murmurs either. Now we're going to move on to the patient's abdomen, so I'll keep your privacy maintained here. So upon inspection, his skin is intact. It's nice and warm upon palpation evenly, and his hair is also distributed evenly. The color is normal compared to the rest of his body. I'm checking for any abnormal pulsations, which I also do not see at this time, which is good. Next, I'm going to auscultate the patient's 4 quadrants with my stethoscope. Very good. So he has normal active bowel sounds in all 4 quadrants. Very good. And I'm sorry, if you don't mind flexing your knees just a little bit for me. A little bit less. Very good. Okay. Next, I'm going to check for bruits using my stethoscope at the renal artery. The aortic first, which I do not hear. Then the patient's left renal artery. And the patient's right renal artery. And then moving down to the femoral arteries. And now his right femoral artery. And no bruits are noted. Very good. Okay. Next, I'm going to I'm going to palpate your abdomen, soft first, to check for any tenderness or pain. Any pain or tenderness?
No.
I'm doing all 4 quadrants. Very good. Any pain?
No.
Good. And I'm going to check for your rebound. Any pain?
No.
Good. And then I'm going to do a deeper palpation to check for any masses. Any pain?
No.
No pain or tenderness whatsoever, and no masses felt in all 4 quadrants. Next, I'm going to check for tympany in all 4 of your quadrants. So same tapping motion here. Okay. Upon percussion, the sound was tympanic and resonated fine in all 4 quadrants. Next, I want you to take a deep breath so I can check for your liver border. Take a deep breath and hold it. Good, and exhale. And I did not feel your liver, so that is good. And I'm going to check your midline of your abdomen. No aortic pulsation is noted upon visualization, so that's good. And then, okay, so we check your femoral pulses, and then we're going to, we did your femoral, abdomen, and then hernia. So go ahead and relax your legs down for me. And I want you to lift your head off of the pillow, please. Okay, you can relax. and the patient did not have any hernias noted when he lifted his head. Now I'm going to have you go ahead and sit on the edge of the bed for me with your feet dangling. And I'm going to do your lower extremity peripheral vascular assessment now. So first I'm looking at the patient's skin color, which is pretty much equally distributed with the rest of his body. His temperature of his lower extremities is nice and warm. I'm going to check your posterior tibial pulses bilaterally, and they are a +2 and with a regular rate and rhythm bilaterally. Next, I'm going to check your bilateral dorsalis pedal pulses on each leg. Very strong, I would say +2 as well, equal rate and rhythm. Next, I'm going to check the patient's capillary refill on all of his toes. And I'm also noting that his nail beds are about a 160-degree angle, which is excellent. And cap refill is less than 3 seconds. I'm also checking for any varicose veins, which the patient does not have any. And then I'm going to check for edema or pain on the bony prominences. Any pain at all?
No.
And no edema noted, which is very, very good. Next, I'm going to do the male genitalia, so I'll explain that to you instead of actually doing it. So you would, I would inspect the patient's penis and scrotum. I would check for hair distribution, any bulging or protrusions. I would also palpate for any tenderness or masses on the scrotum as well as the penis. I would check for urethral discharge and the urethral meatus to make sure that you have no discharge. I would also palpate your testicles to make sure that they're somewhat even with no masses on them. I would check your epididymis on both testicles to check for the same things, and your vas deferens to make sure that there's no abnormalities with those, as well as any no tenderness in your scrotum or those areas. Some self-teaching for you at home. You typically do this test yourself at home once a month. You can do it in the shower or in front of a mirror so you can get better visualization. You want to palpate your penis, your scrotum, and your vas deferens, which are the little tubes that hold your testicles, and the epididymis, which are little sacs on top of each testicle, to make sure that you have no tenderness, swelling, anything abnormal or painful. Okay. And that's all. Did you have any questions?
No, I did not.
Awesome. Thank you so much for your time today.
Thank you.